everybody. Welcome to Children and Young People's Committee this evening. My name is Christine Townsend. I'm the councillor for Southwell and I'm also the executive member for Children's Services and Education. Shall we go around and introduce ourselves?
Hello, my name's Jo Holmes and I'm a Policy Committee Officer.
Hello, my name is Katia Hanshin. I'm the Labour Party and I'm from Council for Pleasington East and I'm also the Vice Chair.
Hi, my name is Susan Collar and I am the Labour candidate for Bishopsworth. Councillor, I made it. I'm the Labour councillor for Bishopsworth.
Hi, I'm Ellie Freeman. I'm the Green Party councillor for Bedminster.
Cam Hayward, Green Councillor for now.
George Kelly, Councillor now.
Henry Michalis, Conservative Councillor for Stoke Bishop.
Sarah Classic, Liberal Democrat Councillor for Haygrove and Whitchurch Park.
Kerry Bells, Hartford and Woodwood.
Hi, I'm Annie Gillett, Senior Commissioning Manager for Children and Education.
Hi, Fiona Tudge, Director of Children and Families.
Hi, Emma Lloyd, I'm Head of Service for Inclusion.
Hi, Shane Wells, Children's Services Performance Advisor.
I'm Hannah Woodhouse, Executive Director of Children and Education.
Okay, thank you everybody. So you may have noticed that we have one substitution. So Councillor Kalashoni is substituting for Councillor Jeffrey, so that's a straight swap. We are not expecting any fire alarms, so if one does go off, then we do have to respond to it. And the exit is where we came in, through the main front door, and we meet down the slope outside the cathedral, apparently. Okay. Can I ask any of the councillors whether they need to declare any interests or conflicts with any of the items that are on the agenda today? Everyone shaking their head, I'll take that as a no. Okay. Okay, so moving on to item 4, which are the minutes of the previous meeting. I'm going to assume everyone's had a read of those. Has anybody got any areas of clarity or any typos or anything, or any points that they feel needs to be raised? Katja?
It was just about the proposal for the task and finish group. It's okay in the minutes as it stands, I'm not disputing that. And it was just that I followed up on it and we need to put a formal representation in, so I was just hoping to do that by next committee meeting, if that's okay. Because we have to formally vote on it, apparently.
Maybe we can have a think about that later on in today's meeting. Yeah, I do remember that I asked if there was anybody else that wanted to bring any specific areas forward for task and finish. We have 2, we're allowed to have 2 in any one sort of municipal year, so I think that the area that was suggested was around attendance, because it's huge and it's multifaceted. And Katja, I don't know, we had a conversation about maybe Katja leading on it, let's put it that way, yeah. So we'll maybe come back to that at the end of the meeting, and we can have another discussion on that one. So there was one action, and that was around the Equality Improvement Performance Board. There was some questions, I think, from the public forum about some data and some information minutes.
Yes. So
Yeah.
The request was about sharing the minutes with cabinet members. I think it was from Sarah.
Right, this one.
So I think you were asking whether you could see the minutes of the improvement board, and I don't want to sort of course, in principle, happy to do that. The reason why we were suggesting that we don't do that is because what we need to be recording is obviously not necessarily information that we want to go. We want it to be all about improvement. So what we will do is bring here, and you can see it in the report I'm about to present, is a summary of the issues that we have discussed and what we're doing about them.
Yeah, that's absolutely fine. I think it didn't necessarily need exact minutes, but just a summary or an update, or just some insight into what's being discussed and what's going on in the board.
Okay, thank you. If everyone's satisfied with the minutes and the actions, we'll move on to number 5, which is Chair's announcements. There's been 2 really quite important events this week. So the first one earlier on was the launch of the SEND Inclusion Strategy, which most of us you might be aware of. A number of us were there at various points during the day. It was held in this building. And that is a culmination of probably 18 months, 2 years worth of work, working with all the different partners, the different stakeholders, to try to bring a strategy together that will keep us going basically for the next, it's so safe for the next 4 years, but I can't imagine that we will go 4 years without reviewing that. I would imagine that would need some kind of reviewing 18 months, 2 years into it, I would think, to look for a refresh. And that is now, it's a draft strategy, so it's out for consultation, and we are encouraging anyone and everyone that wishes to contribute to that to please do so. And if you're in a position to promote that within your ward and with your residents, then please do so. And certainly, members of the committee, please, let's have your comments and put that in. The idea is that that closes on the 28th, is that right? 28th of October, so it's been open for a couple of weeks. Once all of that information has been shifted through and collated and put together, that will be added into the draft report, and then it's timetabled to come to this committee for January for us to officially sign off that new strategy. It's the second strategy this council has had since the new code of SEND practice was published in 2014. The previous one having run out in 2022. So, and it's in response, I suppose, on top of and making sure that we're all working alongside and we all know what our issues are and which direction we're moving in and where. So that was an important event that happened today. And the second one was earlier on this afternoon, a couple of us were at, and that was it was a launch of a foster care recruitment campaign. So this is about 100 local authorities were involved in contributing to and making it's quite a short film, and I've suggested, because we've got no public forum, that we watch it during the public forum time. So it's about, I know, all of us were it. It is quite an emotional. It's heartfelt and it's quite emotional, but it's real, and it doesn't. You see the good side, but you also see some of the challenging elements of what it is to be a foster carer. So this is being used at the national level, but also at the local level, to try to encourage people to come forward if they're considering being a foster carer. We know that children, for whatever reason, who aren't able to remain with their birth families, the best outcomes comes from a place that is with a family, and we know that, and we've known it for decades. The importance of trying to make sure that we're basing it on evidence, and so this is, alongside the other local authorities, is another tool for us really to try to promote. And if there's any events in your ward where members of residents might come, there might be gatherings, please consider having there's stands and things like that. Consider having a foster care recruitment stand, so that we're all in a position where we're trying to encourage our residents to think about whether they're in a position to open their homes and their hearts to care for one of our looked after children that are cared for by the council. So shall we watch the video? Apparently it's working. Have you guys seen it? You know? Okay.
Hi, I just wanted to wish you a very, very happy birthday. So good, I can't be there in person. But I hope you
Okay, so I will fill some space while people get a tissue out or something, because it's, yeah. That's the second time I've watched that, and I wasn't quite as emotional that second time. And I'm looking at our journalists to see whether they might be interested at some point putting an article together about the foster carer recruitment, because I think that you could have a link to that video that would be really good. Okay, thank you. So that was this afternoon when that launched, and we had, and it was also, those of us on the corporate parent, there was also a launch of the Mockingbird model, which is where you have an experienced foster carer that's kind of in like a hub, and then they provide peer support for foster carers that are kind of attached to that particular hub and spoke style, and the evidence it comes from America, and the evidence from the States say that this is a really good method of supporting foster carers, and so that was also launched today, and those of us that are on corporate parent will hear more and be able to follow the progress as that programme is rolled out in Bristol. Okay, so we are on to item 7, which is the Children and Education Service Update. So this is for noting, but this is looking at all of the areas really that have kind of progressed, and updates in all the different areas since the last time that we met. There isn't any data in this one because 6 weeks is not really long enough to have any notable changes in data, but we will get updates in those data sets for our next committee, which will be in November. Okay, so I'll hand over to Hannah to give us a rundown on the performance.
Thank you, and I haven't seen that, so thank you, Christine, because it's very powerful. Thank you. So as Christine said, we presented some data last time. It's the first time we've done it. We will be doing that in the November report. So we wondered whether we had enough to say, and it turns out that we've got quite a lot to say. So I'll summarise the paper, but I'm obviously happy to take questions on it. First of all, obviously, we are working closely to understand the priorities and proposals from the new government. Like many across government, I think we're all waiting for the budget. I think after that we will see clearer proposals, I think, about how this government intend to approach some of the sort of pressing challenges that we see. Obviously there was some announcements today about early years, school-based nurseries. There have been a number of announcements about sufficiency in early years. There have also been the changes to school inspection reports and the removal of single word judgments, as well as the development of a report card, so a more sort of context-based report card where the school, the judgment on the school will reflect much more the context with which it's in. So looking forward to seeing more information about that. It's worth saying, linked to that, there is some wording in the Children's Wellbeing Bill which sets out that it will require all schools to cooperate with the local authority in school admission, school inclusion and case planning, giving local authorities greater powers to help them deliver their functions on admissions to ensure admissions decisions account for the needs of communities. So I think that is quite a big shift policy-wise, and again we wait to see more detail on it. And then moving on into, obviously there's a curriculum and assessment review, but a skills drive. But I think what we're waiting for, obviously the commitments around VAT to independent schools, but I think what we're waiting for is information particularly around SEN. So SEN policy and SEN funding. It will be interesting to see where the department go on that, as well as obviously in terms of social care policy more broadly. So I think we can maybe report when we get to the next update. We have held a children's improvement board, which looked at inclusion, attendance, families experiencing homelessness, transitions into adults for disabled young people, and I've set out updates in the report here. So I won't pick out everything in here, just a couple of sort of things to note. Firstly, on we continue to monitor attendance, and attendance at the beginning of the school year is always a better. But we are working closely with schools across the city to keep a close eye on attendance. Really welcome the task and finish group, obviously happy to support that. I suppose there is a bit of data in here, but we've brought the primary data, so we've brought Key Stage 2 results to this report. And it is concerning that you can see there the performance of Bristol compared to the national average, which has continued to drop. I mean, the whole country dropped after COVID, as we know. The rest of the country stabilised, slight improvement. I mean, these are big figures, these are all children, but Bristol continued to decline, and that means that on average we are within the bottom 10% of local authorities in the country in terms of primary level outcomes. And if we look particularly at free school, with the performance of children on free school meals, we are 7 percentage points below the national average, and I think 30 or something percentage points below the national average for all children. And so we have really significant work to do at primary level across the schools in the city. That's maintain band academies, and we have done some work over the summer on our school improvement framework. We're about to issue that to primaries across the city, and I'm happy to bring further updates in future. We're doing work around places planning. So I've talked before here about the reduction in pupil populations across the city, which again is a national issue, but we will need to remove classes across the city in order to prevent the need to close schools. Obviously we need to do that as a partnership, so we need to do that with the trust, because we only have the ability to change the pupil admission number and maintain schools, so that's something that we need to do in partnership. And we've launched some work working with trusts across the city and maintain schools to identify where schools are able to take out classes and when, in order that we can make sure that everyone is sustainable, and we aim to do that by December. There's some post-16 data there which we will continue to focus on. Emma will talk in a little while about the SEND strategy, which you've already mentioned, Christine, and the Early Intervention Fund. It's worth saying that we continue to look closely at performance of the children requesting EHCPs, and there continues to be a heavy demand for children with EHCPs, as we know, and we continue to try and process and support those plans to develop as quickly as possible, but there is a timeliness issue still, as we've reported here before, and we will report in our next set of data. So I'm really conscious of the distress and the uncertainty that can cause to parents, and I know that the councillors will be hearing that, I'm sure. Going on then into safeguarding, we've got 2 child safeguarding practice reviews underway at the moment. One of them is around the serious youth violence, which we experienced in the city in February, and the other one is around a family child deaths at the same time. And then, so both of those will be published in the spring, so, and they are about learning across the whole partnership, and so again, grateful to partners who are taking part in those practice reviews. Just in terms of the bits of work that we looked at in the improvement board, families experiencing homelessness continues to be one of the biggest challenges that we see, particularly in children's social care, and a contributing cause to the breakdown of families. And so we're working with the housing team to look further at the decisions around temporary accommodation in particular, so that we can support families with vulnerable children earlier, so that we can get that support in place, and we don't see it falling into children's social care, and therefore creating cost and anxiety for those families. So it is an issue in the city. We're continuing to work on it. And again, there's an update there around transitions to adulthood. We are hoping to sign the development agreement for the youth zone, which will be built in Filwood in South Bristol. And as we know, the Cabinet approved the mandate for the project in March, under the previous administration, and there's some detail there about youth zones. Again, happy to come back and talk about the services that they're providing, particularly how they're engaging closely with the local community leaders, in the development of those services. So we're expecting to sign that development agreement in the next few days. I think just moving on to, I suppose I just wanted to note that Bristol Sanctuary Services, which is a service which cares for sanctuary seekers from a range of immigration backgrounds, resettled refugees, asylum seekers, Ukrainians, and people with no recourse to public funds. So this service has moved into children and young people's services. It was previously held in the adult services, obviously could be in either, but because of the number of children and families that are affected, it's moved into our services. We'll report to this committee, so we're just updating you there, but we'll obviously continue to work closely with our adult colleagues as we support those families, which is an important, Bristol as a city of sanctuaries, obviously an important part of Bristol's work. And then we talked a bit about foster care as a campaign. There's some detail in the report around the outcomes of children in care, so it's outcomes in school and children in care. And we've seen slightly better improvement in terms of the number of children in care and the outcomes that they're getting, but they're obviously still considerably below the average of all children across the city and nationally. There's loads of work to do around the support for children in care and education, but particularly around fixed term solutions. So we are seeing too many children who are in care being fixed term excluded from schools in the city. And James Gregory, who's our virtual school head, has been working with secondary schools in particular to highlight that data and to share it with them. But I bring it here for that reason, and it's set out here in the report. One of our children's homes is now open, and another is at the application stage, so that's part of our sufficiency work that we're talking about, that we talked about here. We did undertake a youth justice service. We haven't yet had the feedback, but we will bring that here when we've got it. And I think the last thing to say is that we're working on a children and education strategy, which will be about all of the work that we do across the city in the council, and wanting to do the same with partners. We've got a number of HR consultations in place at the moment, particularly across children's social care, SEN, and school improvement, which are about how do we develop more of a preventative and early intervention focus to our work. So I just wanted to note that here. And thanks for taking questions.
Okay, thank you very much. So, any comments or questions from members? Councillor Bales. I'm sure there will be others.
I wanted to ask about wraparound childcare and breakfast clubs. Is it going to be made more accessible for children with SEND? Because if you've got an EHCP that says you need a one-to-one, quite often wraparound care and breakfast clubs don't provide that for the children, and it might not necessarily need to be the one they have in school day with them, but just extra staff so that those children can access wraparound care and breakfast clubs.
I don't know specifics, so rather than I try and give you some details, can I send you some information?
So I asked both about wraparound care and breakfast clubs in relation to deprivation, recognising that the deprivation measure captures a lot of those other groups of children that are overrepresented within disadvantage. And the kind of the response I got back was there's still what needing to understand what weighting, if any, the DFE puts on certain things as to how it is that they then want it to be rolled out. And my motivation for asking was understanding that there will be some schools that will be almost ready to go, yes, we can do wraparound care, here we are. We need X number of places, here we are, we've done here's your forms, and they'll get it in, no problem at all. And then there'll be other schools for whom, largely where the need is much greater, and therefore the staff are much more knackered, basically, because they're supporting children and families and communities in a much deeper way. not only physically but also emotionally. And very often when there's an opportunity, it's those individuals and or institutions that are best able to take, they're immediately able, or they're quite quickly able to take advantage of it and get in there early doors. What are we doing? We're just reproducing the structures of disadvantage, because those that are already advantaged are the ones that get through the door first. So that was my motivation, but I completely accept that actually there's a weighting probably that needs to be in there, and it will be very interesting to see what comes down from government in terms of kind of instructions to how it should be used, and then making sure that when it's rolled out, those children are in the mix. But I know that both of those things we want to be in a position where our special schools are also accessing it, but I completely recognise that actually most of our EHCP kids are in the mainstream. So
if you're deprived and you've got an HCP,
yeah.
then you probably need that support more than
No, completely, absolutely. And they getting assist. Have you got something to say about it? Yeah, go on.
Yeah, it might be touched on a little bit later in the CDSS extension, but at the moment we're commissioning BAND, Bristol Association for Infant Daycare, and they are working with childcare providers to get them ready for the rollout. And part of our reason for bringing the extension is because their contract was due to end in the middle of that. And actually they are doing a lot of work around ensuring that settings are accessible. And that's something we've kind of reflected on as well, that they're doing work now, but for the new commission, we want to review that and make sure there is a focus both on deprivation and accessibility for children with SEND.
Anybody else? Susan? Yeah. Susan and then
It's just a question because of the type of young people that I work with. I work with children that are SEND, that I have EHCPs and stuff, but I also work with a lot of young people that don't quite get an ECHP, so they're what we call high needs. And the reduction in high needs money has been quite, had an impact on the way that we manage and work with our young people. And I don't know if how it works in terms of, we talk about EHCPs and SEND and stuff like that, but we don't always talk about high needs in respect of, we recognise what our young people need, but to provide that, you need things like high needs money and stuff, but there's not always enough. And I don't know if that is just lack of funding, or we waiting on our budget. I don't know how it does. But it's about how we are making an impact on young people's lives that don't quite fit into all these little niches of other things, but have obviously additional needs, especially around things like pastoral care, because that is actually, for us, is just as important as the actual education, because you can't educate if they're not happy, you can't educate if they're struggling in some other way, shape or form. So it's like, how do we support those young people, children and young people that don't quite fit into those like EHCPs and stuff like that. That's what, I don't know if...
So yeah, I mean totally, yeah, absolutely, because what we don't need is lots of different pots of money, which, as you say, don't necessarily always cover. I suppose I'll come to Emma in a second on the early intervention fund, but I think, the first point to make is school funding, has been really challenging over the last 10-ish years, and I understand that there was a pay deal which has been struck, which is fully funded, which is good news. However, I think if you had school leaders here, they would say we don't have sufficient funding to be able to meet children's needs full stop. So the base funding for schools is challenging still, and we're in a recruitment crisis, is the language lots of people use, particularly around teachers and shortage subjects. And so, I think there's obviously an issue in any case with the sort of quantum of funding that schools have got. And you've got things like equal premium, which reflect deprivation indicators, and that I think now is probably the best indicator, because it covers a sort of whether you have been under that measure for any time under the last 6 years, so it's a sort of fairer position than we've had before. But yes, it is the case that we removed the top-up funding, which was part of the funding of high needs children without EHCPs in Bristol, and that was a decision that was taken last year. And we have replaced it with an intervention fund, which Emma can talk to. But I suppose, you know, I just wanted to recognise the point around how do we support children with high needs, which, you know, may be intersectional, may be using a number of different categories, and it continues to be a challenge. I think the sort of the challenges around how can schools work together with each other and with us in order to get the best provision in place across the city, and that's the work that we'll be wanting to, that we're doing. But Emma.
So in terms of the early intervention fund, you're absolutely right. It's an early intervention fund. It's we are trying to make sure that we are in that prevention and early intervention space. It has been really welcomed by schools and SENCOs and leaders in terms of the fact that we are trying to recalibrate where we are to make sure we don't have children at crisis. We're putting in that intervention really early. Without knowing the children and young people that you're working with, I would say if their needs are that high, then that's a conversation that it possibly needs to be had with the SENCO in terms of whether actually it is appropriate for an EHCP needs assessment for those children and young people, or actually is there something else that can be done, and access to that early intervention fund might be able to help. So, for example, if they are struggling with social, emotional, mental health, but actually the reason is because their learning is behind their peers, some money from the early intervention fund might help to boost them and close that gap, and actually some of those other needs may then be more manageable in school. But without knowing the children, without knowing the circumstances, you know, we're trying to get upstream to make sure we don't have children in crisis, but we also recognise there will be children that possibly were masked in that high needs funding bracket before, and it is right and proper if that's appropriate for those children to then have an EHCP. But we're hoping that actually if we get in there early, we will prevent the demand that we're seeing at the moment coming through the front door.
That's brilliant, thank you.
Okay, and Henry?
Sorry. In the point 10, the school results, that the expected standard for English, writing and maths has fallen, have you seen a correlation in the rise of school absences as one of the main contributions to that? And I suspect that we'll talk about task and finish group and tackling school absences should in theory rise those results.
Yes. Yes. Without doing some deep research, I think yes. I think that it's probably because we know that the attendance in Bristol is lower than the average, and we know that these results are lower than that at national. So I think that there's got to be, in my mind, there's got to be some correlation between those two things. Causation, don't know. I think we need a PhD or some piece of research for that. But certainly, if we can improve attendance, then of course children will be better able to reach the benchmarks for reading, writing and maths. These are also, this is the specific experiences I think as well of COVID, because how different communities and different groups up and down the country experienced those lockdowns were different. I think it's a complicated picture, but yeah, reading, writing and maths will be the absolute priority for the school leaders that are coming out of this. But this is an average, so there will be some primaries that will be a lot higher than this, and it doesn't take Einstein to work out probably where those are located, and then there will be other primaries that will be much lower than this, and on the whole, we probably know where those primaries are located. And this is why I'm reminding the officers every time, and we need to do this every time. There's some project that somebody somebody wants to bring into schools or into the question is, how are you, from us, I mean this is, how are you as a project making sure that you're reaching the most disadvantaged? How is it, you know, which school, you can access these here are the schools in my ward. These are the ones actually that if you can reach these ones, I'll be really impressed with that, because you know that those are the schools that have got the highest levels of need within their cohorts. And if we can try and direct all and as many resource towards those children, then that will help to improve that average. Because we know that there will be parts of the city where there'll be above national, they'll be knocking on 75-80%, no problem at all, and then there'll be others that are probably at 30. And that huge gap is part of the things that all of us need to be thinking about when we're approached by people, or when there's some funding that's come through, something just, you know, it could be a community group, it doesn't have to be anything to do with children or young people or schools, but it's about trying to make sure that it's directed towards those communities that we know are in most need. And I think that at the moment that's what we're able to do.
Yeah, and I think only just to, definitely, and I think only just to add that we had a really productive conversation with the primary heads about this data last week, and they would be really with us and saying, you know, really determined to challenge and improve outcomes for primary pupils. We need to do that as a city. It's not just maintain schools, it's not just academies, it's all schools. As you said, there's a correlation with deprivation, definitely. But it will also be about quality teaching, learning and leadership. So this is about children and families and COVID and poverty and inclusion, but it's also about quality teaching, learning and leadership within the schools, and the primary heads will agree, I'm sure, with that as well. So it's a challenge we want to see in May. We want to see that data improve, particularly for children on free school meals. And there's absolutely no reason why those children could achieve less than any national average at all. So that's why we brought it to the committee. Thanks.
Sarah?
I realise this isn't a full deep down into the attainment, but just a quick, I'm just curious. Obviously, we've got our attainment against the national average. Do we have any idea what the pattern looks like for, say, our comparative cities or comparative authorities? Are they following similar trends to us, or because obviously that national picture is the same way as a city, we're going to have high levels of deprivation in some areas and high levels of attainment in other areas, and that's going to affect that. So how do our comparative cities look in terms of trends?
We can't get that. I mean, given that we are in the bottom 10%, I think that gives us an indicator. But specifically getting comparable city data.
Again, I have got it. I can share it with the committee, but it's not, as you say, it's 90% or so. It's not positive against our comparative cities. We're not doing well. So yeah, this isn't about context. It's absolute. And you know, the good news is we can improve. Thanks.
Okay, we ready to move on? Thank you. Right, so that takes us then to, so what we've just looked at is for information, and we're going to move on to item 8, which is the performance management report for quarters 1. So this is the first 3 months of the financial year, which is April, May, June. That's right, isn't it? Yeah. Yeah. So this is performance management, and this is this you as well, Hannah? Shane, right? Shane, presenting officer Shane. Thank you very much.
This is just quickly to highlight that this is specific to the information that's contained within the business plan for 24-25. So there is additional information in the report that obviously Hannah presented, and will be updated next quarter. There are 3 appendices to this. One of them is an interactive dashboard that I'm imploring you to go look at. That contains information about all the committees, but can be filtered down to look at the ones that you are interested in that contains all the information. Appendix 2 contains all the information that's relevant to this committee specifically in just in a table format, so that it's easier to read and access. And then Appendix 3 is theme reporting that was relevant to this committee. From the Q2 onwards, there won't be theme reporting because the themes don't particularly align well to the committee system, so the process of those is being reviewed. Just the quick highlights of what was highlighted among the performance challenges from within this is the aim to reduce the percentage of children in care placed out of area and increase the percentage of children in care placed in house provision. That sort of aligns with the fostering video that was shown earlier and the general trying to move children towards us, but obviously we set challenging targets against that are difficult to reach, but hopefully we'll start going in the right direction soon. And the timeliness of education health and care plans issued within 20 weeks, excluding exception cases, which, as I've mentioned previously, is also a challenging area. If there's any further questions, feel free to ask.
Okay, has anybody got any comments or questions relating to this? Ellie?
HCP is my favourite things ever. So when we talked about this, we looked at this before this meeting, so it was quite helpful to just digest it. And with the EHCP data, I wondered how you're measuring, so having gone through this process myself, how you're measuring when an EHCP gets rejected and then appealed and then comes back, because obviously that extends the period that it gets approved. So ours took 52 weeks. Sorry, I'll say this every time then. But, you know, it'd be interesting to see whether the ones that go straight through, whether actually they're sort of hitting target and, you know, how that sort of all interplays, if that makes sense.
I'll have to get that detail of information, but I can get that to you. Absolutely, that's not a problem.
Because one of the things that was mentioned at the SEND launch in the week was what we've had is a target for 20 weeks, and I understand why we have a target for 20 weeks, because that's what the law says it should be. But we also have an average that was much later than 20 weeks, it was something like 36, 38 weeks, something like this at one point. But what that also told us was that there was this other bunch of assessments that were, and some of them were going beyond 52 weeks. So it had this huge, long, possibly very thin tail. Surely it's this bit that is showing us, or it's the analysis at this bit that enables us to see which bits of the system are working, or which bits of that multi-agency, particularly system, are working. And so hopefully bringing this tail in, and it might mean that actually the 20-week target slips a bit, and we have seen that. I'm not exercised by that. Others may well be exercised by that. I would prefer to bring the tail in, so that the system is kind of working in a sort of a better shape than something that's like that. Yeah, Helen, do you want to comment?
Yeah, I just wanted, because obviously that specific information I can get to you. But in terms of this time last year, our waiting time was on average, the average waiting time for the HCP was 36 weeks. We've now not improved it greatly, but it's down to 33 weeks, and we're working really hard to make sure it gets closer to that 20 weeks. But we are really, really, really making sure that we don't breach that 52 weeks as well, because as you know, Councillor Townsend just said, we don't want there to be families waiting for the length of time that it sounds like you waited for your chance in HCP. So we are trying really hard to make sure that we might not get down to that 20 weeks, but we certainly want parents and families to be waiting well and waiting for a less time on average, but making sure that nobody waits too long for their EHCPs.
That's really helpful, thank you. And I think also understanding that 20-week target maybe not being realistic for us at the moment is actually really helpful for parents and schools to sort of convey that message as well. So as a parent, you're not thinking, oh my gosh, you know, what is happening? 20 weeks is long gone, but actually there's a more realistic target that you are managing to hit, and that just helps people get their heads around that, I think.
and sort of coming back on that again, I'm working with our brilliant parent carer forum in Bristol, and we are looking at how we help communicate all of this information really clearly in a timely way, not only to families, which is obviously vital, but also to schools as well, so that they can support families, and that means having that realistic, you know, we know what the statutory timeline is, and of course we are working really hard to meet that, but making sure that where we're not going to meet that, families aren't just left.
Okay, so we are asked with this performance report, we're asked to note, as per the recommendation, people are happy to note. I see nodding heads, thank you very much. Okay, so we move on to item 9, which is quarter 2. I have to explain that. What is it quarter 2? I'm not quite sure. Quarter 2, the corporate risk report. So these are areas of this directorate that are at the corporate level because they're considered to be really quite serious. We've got safeguarding children in this area, so obviously that's always going to be pretty much on there really. And Hannah's going to introduce it to us. What's quarter 2?
It's every 2 months, so I think it will have ended in September. Is that?
September, yeah. No, it's just, so it's just a question of getting, when the data comes in, being able to get the data together.
So this is also a regular report. So what you can see here is the net report, the finance report, and the performance report from Shane are the sort of regular corporate reports that we bring through all committees. And again, we talked about this report, or I think it was, we talked about the risks here last time. What you can see here is the highlighting of risks and the matrix there. So obviously you have a number of high risks which will, I think, always be on our corporate report. One is around safeguarding vulnerable children, children placed in unregistered provision, dedicated schools grants, deficit management in particular. So you can see those four as well as our statutory duty in respect of children, so that will refer to our 20-week place, which we've already talked about. So there are two, I think it's fair to say that all four of those risks remain risks that we're really aware of and are managing, and there's a sort of matrix in which is managing them going up and down, but I think they continue to be risks that we continue to be aware of and continue to monitor and will report on the corporate risk management strategy. I'm just taking any questions.
Has anyone got any questions or comments about the risks? Ellie, go ahead.
Just a very quick one really, that I ended up subbing for strategy and resources the other day, and so obviously saw the corporate risks, and there was some concern expressed about how, you know, that these risks are still on there and they're really high. And it was really useful for me to then be able to say, actually, as a committee, we have good oversight of that. You know, you're giving us loads of information. We feel really informed. We feel that you are really aware of it. And so being able to feed that back was really helpful. So you might feel like you're giving us lots of information, but it's you know, that's how it's all working, and that sort of cross committee stuff is really useful. So thank you.
Okay, people seem happy with that. So we're asked again. We're asked to note this particular report, and I'm assuming people are happy with that. Okay, so agenda item 10 is the period 5 finance update. Hannah, again, this is yourself, so you're giving us an update on where we are with our private money situation.
Far better presenters over here, aren't we? But so again, this is a regular report which we will bring, and again, there will have been, I'm sure, discussion about this area of the Strategy and Resources Committee. It's worth saying, you know, obviously really welcome both around risks and around finances. And it's good that Strategy and Resources are talking about children's risks, and thank you for that. So the headline here is not that dissimilar to the previous report that we brought. There's an overspend against the £128 million budget, we've got an overspend of £23.8 million against our general fund for what we call P5, which was the position in August. And that was made up of, the biggest bit of that overspend is £16 million worth of overspend on residential placements. So Hannah will talk a little while about Children's Home Sufficiency Programme, which is very much part of how do we continue to manage the number of children going into residential placements, and particularly the limited choice that we've got in terms of buying those places. By definition, they are the highest need places that we buy, they are the highest need children. We increasingly have numbers of teenagers going into those residential placements, which increase complexity and cost. And you might have seen nationally there has been some work done on how can we manage, they will need to legislate to manage the children's care market so that we have less of a position where we have no choice about suppliers and the cost of provision. But it remains the case that I think as of today we still have 92 children in residential placements. We continue to have that overspend in our placements. We're working really hard to support children safely back either into fostering, which is why we need to have more foster carers, or into our own children's homes, which Hannah will talk about, or home safely with families, which we know is the best for children, where that's appropriate and safe. And we're working really hard to step children back into those placements. It's probably, it's the single biggest and most important piece of the work that we're doing at the moment. There will always be children who require residential placements appropriately. But what we want to make sure is that it's those children and only those children that have those places, and we manage that carefully. So that is where the overspend is coming from and continues to come from. We've got, and I can talk, I think we're bringing an item in November about our transformation programme, which is all about early intervention, prevention, family health, family hubs, and we can talk a bit more about that there. So that's the first area, and then the second area is home to school transport, where I think we've already reported that we have an overspend against our home to school transport budget. That's because we set out some savings which we didn't make. So you can see that in the report. If you go to the savings section, you can see there are a number of savings which were not made. Partly that was a deliberate decision by the council not to take savings against some changes to the way that we deliver post-16 send transport, which I know is I'm sure will be a subject that we will talk about as a committee going forward. But other areas do relate to the increasing pressure that we have of children requiring the HCPs are being placed outside of the city because we don't have enough specialist places, which therefore costs us in terms of transport. So again, it comes back to building enough capital, building through our capital programme enough specialist places for children with the HCPs, which not only is better for them, but also will reduce our home to school transport budget. So that's the second area. The third area we've talked about before is around no recourse to public funds. So these are families who are presenting with no recourse to public funds, where we, through Children's Services, are supporting them in very, very, very dire circumstances. And again, we're looking at how we can make sure both that we obviously continue to support families that are in need of support where we're legally required to do so, but also how can we do that sustainably with the budget that we've got, working closely through Bristol Sanctuary Services, which I talked about earlier on. And then two last things to say on this report. One is that we have we're reporting a 15 million variance on our dedicated schools grant, DSG, which is the high needs block. So we're reporting a further slippage in terms of high needs provision. Again, that will come back to the demand that we are seeing in terms of children with EHCPs, lack of specialist places, and we continue to be in discussions with the Department of Education about our safety valve deal, because we are at variance from our safety valve deal. We've reported it here before as well. We're working really hard to bring that back as quickly as we can by building places, by supporting children earlier in the way that you've already talked about, as well as working closely with schools. And then we've also got our capital programme set out in this report, where you can see we're working really hard to spend the capital that we've been allocated, including on children's homes and specialist places. So happy to take your questions.
Okay, anybody got any comments, questions, Katja?
I just wanted to ask you, with the latest judicial review on the safety valve, does that affect anything about our delivery of the safety valve or how it's going to work in the future?
Yes, I can answer that. So, it's a matter of, I think it's a matter of public record that we were challenged on the decision to enter a safety valve line payment from Bristol. And what has happened has been that the judge has deemed it arguable that one of the grounds on which the claimant brought the case could be argued. So there has been no decision taken, we haven't yet had the trial, but there will be a hearing unless anything changes. It's planned for later on this year, particularly on one of the grounds that the claimant brought in terms of our decision to enter the safety valve. I mean, it's worth saying, I'm conscious of all of this is wrapped up in sort of legal debates. It's probably the limited amount I can say, but I think that probably the most important thing is that we really want to work closely with parents to support children with EHCPs or children with SEN in Bristol, and Emma will talk about the work that we're really committed to doing that. We will continue to do that. No, there's no change to that at all at the moment, and I don't want to speculate on the outcome of the review or whether it will change, but obviously we'd be very concerned about that if that were the case. And we'll continue to work really closely with through this case to try and reach a sensible conclusion. Thank you.
Anyone, any other comments or questions relating to the various elements of the finance? My understanding is that the main capital underspend is this delay in the youth zone, because it's 4.4 million, and most of that is the youth zone stuff, isn't it? Because there's so the youth zone, we are not the deliverer of the youth zone. On-side are responsible for building it. I don't know what that noise is. On-side are the ones that are delivering that. So it's a bit like the Temple Quarter secondary school, where it's in our patch, but the DFE is delivering that, and it's kind of running over. Things are progressing with it, so hopefully that'll be out the door quite soon, and they can get on with delivering and building that particular zone. Any other questions for finance, Susan?
You say about working with parents, to work closer with parents and stuff like that. How do we do that?
Yeah, that's definitely not a question. Yeah, Emma, do you want to?
I mean, I'll touch on this in a bit when I talk about the SEND strategy, but we have worked really hard, and we have, with Health, our Parent Carer Forum and the local authority, now got a memorandum of understanding and a co-production charter. Basically, we're really working hard to make sure that all of the partners are involved in all of our decision making, all of our planning, making sure the services work for all. And it isn't, Bristol Parent Carers are also working with a forum of friends, so it extends wider than just those parents involved in that. But we're also making sure that we, through our schools and settings across Bristol, with the SEND strategy, trying to really engage with as many parent and carers as we can in order to make sure that we are really reflecting their feedback, their experience, and we really do need to make sure that children and young people and their families' experiences really help us shape what we do and how we make decisions. And hopefully the SEND strategy and the co-production charter and the memorandum of understanding are all indicators that we're moving in that direction. And I have to say, particularly Bristol Parent Carers have been absolutely fantastically warm and welcoming to me. It's a new issue to post, not that new now, and making sure that they work with us on all that we do. So I'm sure there are lots and lots of areas that we need to still do more in, but we're open and hoping that we've got the sort of foundations and the framework of that really good partnership working.
Thank you.
Kerry?
Just a comment really about the the relationship between the counselling services and parent carers, and I know that you're doing really great work, but from a parent carer perspective, it still doesn't quite feel like that relationship where it should be. And I brought this up at HOSC earlier this week. As a parent carer, I've got one view, and as a counsellor, I kind of get to see a different perspective. But from what other parent carers have said to me, that it's still not where it should be. We've had a lot of scandals over the years, and I think parents are holding on to that, and there's safety valve concerns just adding to that.
I totally understand that, and I totally understand that trust takes a really big length of time to build. And you know, as I said, I'm not under any illusion that we're kind of there, done and dusted. But hopefully we're moving in the right direction. Hopefully we have got a really open and positive and transparent relationship. As I said, particularly with Parent Carer Forum, because they are our biggest partner, but not exclusively them. For example, last Thursday at the inclusion event, the chair of the Parent Carer Forum, a senior member of the ICB health team and myself, we did a workshop together on co-production, and we are really committed in all three of our organisations and through the system to make sure that co-production becomes part of our DNA. And I'm not under any illusion that we're kind of at that finish point yet, but I also know that everybody's really willing, and you're right, I think, not in Bristol only, I think it's been a fairly, SEND is very emotive, quite understandably, and it also has been in some quarters, and I'm not talking about Bristol, there are some adversarial bits to SEND, the way that some of the structures are set up. We're really trying hard to make sure that we all want the same outcomes, which is really good outcomes for our children and young people. And so we're trying to make sure that that partnership pulls in the same direction rather than trying to fight. We're not going to solve that overnight, but I think we're making steps in the right direction.
Okay, so that looks like it takes us really nicely actually. So on to the next item. So the finance update is for us to note. Item 11 is the Send and Inclusion Strategy. This is a really key document. There has been a gap in Bristol. As I said, the previous one finished in 2022. I wasn't aware that it was ever reviewed. I don't anticipate that this will run for 4 years without being reviewed. I think they're probably 18 months, 12, 24 months, something like that. But it's a key document for us, and Emma's going to give us the background to how it came together as well, I think, and kind of the scope that this strategy is kind of encompassed to try and pull all the strands together.
Yeah, so this is again another one for you to note. It will be coming back in January, hopefully, for final approval. We are currently out for consultation, which opened on the 16th of September and closes on the 28th of October. And we are working really hard. So again, I know Councillor Townsend already said, can you please make sure you share it with anybody and everybody you come across. We want as many people, professionals, families, children and young people themselves to feed into this. And I'd also like to thank the Chair and Deputy Chair for their support on the 10th of October at our inclusion event as well. So the strategy sets out really clearly how we want to work in partnership to make the improvements for children and young people with SEND in Bristol. We are really, really lucky. We have had a huge amount of co-production and co-design in this project, and I think, as it was said earlier, this has taken about a year to 18 months to get to the point of the consultation, and within that time there were 750 schools and settings that contributed to the draft, 2,000 parent carer voices contributed to the draft, and 1,500 children and young people that contributed to this draft. And from that, 6 priorities have been identified, which are understanding needs, listening to families and our children and young people, making sure that the right help is at the right time, making sure that our education provision across the city is inclusive, and that's not just that mainstream inclusion, that's also talking about that wider, making sure that we've got the right specialist provision in the city. Preparation for adulthood, and again this starts in the code of practice, it sets out that starts in early years, and we need to make sure that we are from that earliest moment helping children to prepare for education or employment or independent pathways into adulthood. And then the one that, they're all very, very important, but the one that I think probably is the most, resonates the most given some of the things that happened in the city earlier on this year, is that children with SEND want to feel safe and included, not only in their schools but in their communities. We've also really lucky, we've had artwork by a local artist, Ruth Broadway, which was it's captured the listening partnerships, children and young people's voice as well. The listening partnership covered children and young people with SEND from the ages of 13 to 25 in Bristol, and we're really grateful to Ruth and to the listening partnership for all of their support. How are we going to know that we've made a difference? I think the sort of impact measures are going to be really, really important, and again I'm sure in the committee moving forward, as Councillor Townsend said, part of our iteration of this and our review of this will also be making sure that we're making that impact that we're hoping for. So we want identification and assessment to be timely with the right professionals at the right time, and families and children and young people to feel that they are partners in the decision making for what provision is needed and the support their children need. We want mainstream schools to be consistently able to meet the needs of SEND children and young people, and have enough provision locally to meet the needs of the children in the city. We want children and young people to have their voices heard and help be prepared for the next steps in life, including independent living, employment or further education. And we want to make sure that all of our SEND children and young people in Bristol feel that they can participate in any activity in school or in their community and feel safe and valued and included. So the 6-week consultation, as I said, opened on the 16th of September, closes on the 28th of October. The actual consultation itself was co-designed with Bristol Parent Carers. It has been translated, or there is a translated version in Somali and in Polish. There is also an easy read version available. And at the event on the 10th of October, we had around 200 various parents, professionals that were able to come in and actually participate in engaging in that consultation. We had a target of 200 recipients or respondents to the survey. We've still got about, I can't remember what the date is today, but about 10 days left of the consultation, and we've already had just under 180, and we still have some that are partially filled, so we're trying to make sure that people who have started complete their survey so that we can actually make sure we've got that feedback, and we are trying really hard to make sure it gets out and as many different people contribute to this, because this is a really important document, it's a really positive document and strategy, and we want to make sure that it reflects the voices of the city, because it was written with partners in the city for the city. And I'm quite happy to answer any questions.
Okay, looking at committee members, has anyone got any comments or questions about the strategy or how it was put together? Katja?
I really read the strategy, and I think it's a really wonderful document to read. And I was there at the conference, Wordswin, and it was very positive, and it was really nice to meet a lot of organisations that I hadn't met yet before. Some I have, having chats and conversations with lots of different people, very good networking with a lot of people that was there. I was very impressed with the listening partnership. They brought me to tears when they were talking, and I think we really, really do need to listen to them, and we are. So I'm hoping that that will move further, that I'm going to go and visit them apparently.
Yeah, and I agree. It's really, really moving, and I think we need to make sure that we share that far and wide. A bit like the fostering, we won't have a dry eye in the city with these really amazing videos, but absolutely children and young people's voices are really vital to hear.
And it's, I have to say, from my own experience of my own child, who's now grown up, but a lot of what they were saying, I could have just yeah, because the schools just didn't listen to the bullying at all. And I'm not sure they do yet, so secondary schools, they be clear on that. Thank you.
I sort of say I love the enthusiasm.
Okay, thank you. So, this is for us to note, and as we've said, this will come back to us, hopefully in January, but there might be so much response that actually it's not just simply not ready to come back in January.
I should have said, I can thank you for the prompt. When the consultation finishes, we're already planning in some co-produced workshops to actually take the feedback. We are hoping, we want this to be ready in January, we want this to be something that we can positively launch, and we want it to be something that everybody can be really proud of. So hopefully we will get all of the feedback fed into the system and we will be back in January.
Yeah, we'll be asked to sign off, I assume. That's the timeline. Okay. Thank you very much, Emma. So, moving on to item number 12. This is the Children's Sufficiency Programme business case. So this is in relation to the Children's Services side of this committee, and is related to the general fund as opposed to the DSG or the high needs, because we straddle both of those big areas of funding for a council. And I'm going to hand over to Hannah, who's going to take us through the prep for this paper. Thanks.
Thank you. Yes, hi. We are seeking approval for phase 1 of the Children's Sufficiency Capital Programme, which will agree capital investment of 2.2 million in the development of homes for our children in care. So we've got rising numbers of children in care, and we're struggling to find residential homes for some of our children with the highest levels of need. As Hannah alluded to earlier, there's high levels of profit making within the sector, and that combined with a national shortage of homes has created effectively a seller's market. And the aim of the capital programme is to provide at least 16 children and young people with homes in Bristol, and that'll be through the provision of 6 additional homes and schemes. The aim of that is to reduce high cost out of area children's homes and external supported accommodation, which will support us with delivering savings whilst also holding our ambition of improving outcomes and delivering high quality services, keeping children local to the city they were born. So the business case is split into 2 phases, and we're seeking committee approval today of phase 1, and that includes the development of a disabled children's home. So that will create space for 3 children in the city. There's currently no dedicated capacity for children with disabilities. So the nearest disabled children's home is in North Somerset, so that's really a focus to create provision in our city. We want to develop a same-day crisis home, so that will be a home for 2 children, and that will take children being placed in emergencies where little is known about them, and we need a period to kind of let them settle and assess their needs for onwards referrals to a more permanent living arrangement. And having space to undertake that assessment will reduce the need for further onward moves, which we know is really detrimental to our children in care. And then the development of a young people supported accommodation scheme. That will be provision for between 4 to 10 young people with low to medium levels of support, and that will be in line with the Better Lives in Bristol supported housing delivery plan. So that will be run by an external provider, and that number, sort of 4 to 10, will depend on the provider's model and if they want to leverage in additional money from Homes England, for example. So that's phase 1, and we'll return to committee at a later date for phase 2. So the total capital investment requested is 2.2 million, and that's expected to bring in savings of around £370,000 per year by 2027 when the homes are open. Aside from the finance benefits, we're hoping it will bring a number of benefits to our children in care directly. So children have told us they want to be placed in Bristol, near family, friends and school. An increased local provision will enable more children to stay in the city they were born. and retain connection with their family networks, identity and sense of belonging. And we know that's better for children's long-term outcomes and supports permanency plans and reunification with family. We should see reduced use of unregistered placements through the creation of additional registered homes. So our ambition as corporate parents is that all of our children in care will live in high quality Ofsted registered homes. So creating additional provision will really support that. And improved stability for children in care. So high numbers of placement moves are really detrimental to children's outcomes. But keeping children local will mean they can stay in their local education and access local health services, all of which are protective factors for them. That's it in a nutshell what we're trying to achieve, and happy to answer any questions.
Okay, thank you. I've got a few myself, but they might come out from committee members. So Kerry, Henry, and then Susan was the order I saw the hands.
You mentioned Bristol not having a children's home for disabled children. So where do they go now? Are they sent outside of Bristol? And what kind of disabilities? Because that could mean anything. It could be a hidden disability, it could be a physical disability. That's quite a broad spectrum.
Yeah, so this when we're talking about a dedicated disabled children's home, that is for children who are kind of looked after within the disabled children's services, so they'll have kind of specialist needs that would require either a specially adapted house, or they'll have learning disabilities that mean they need kind of tailored care to their disabilities. And at the moment, so we have some young people placed in North Somerset, some further afield, so they are predominantly going out of area, and that's why we want to create our own capacity so that we have somewhere locally for those young people.
Thank you. Yeah, good to see the report and some really detailed points within. It's also good to see that the amounts of savings projected by 2027 are quite good. Obviously, depending on if phase 1's approved today, when do you expect phase 2 to come back to be talking sort of in the year? Or?
Yeah, definitely within the year. We're hoping within sort of the next 6 months we'd bring phase 2 for approval.
Susan?
My question is really around the housing issue. If we're building houses, organisations, Gorham and all the rest of it are building houses, and they're allocating a certain number of properties for council residency, can we not get some of those allocated for care leavers? In terms of, we don't have enough houses, we're building some, those are for council residents, those are, for this, that and the other. Can we not take a percentage of this dedicated for care leavers?
So we are working with Gorham Homes, so they're going to be opening 2 homes as part of our, not this project, but one of the other sufficiency projects we've already got in train. And there are conversations with them yet about how we can maximise the homes being built in the city, getting dedicated capacity, and also looking at our supported accommodation providers, so our registered providers, who are developing accommodation, saying, actually it'd be brilliant if you could develop something for care leavers, because we know, there is a lack of homes for care leavers, so that's something that is really high on our agenda, and we're having conversations with Gorham, but also more broadly amongst registered providers in the city.
With care leavers, when they get given a flat or some sort of accommodation, do they get additional support to maintain them within that environment after they come out of care?
Yes, so most of our care leavers will move into our supported accommodation pathway, so that they have that kind of wraparound support to develop their independent skills and make sure that they are supported until the point they are ready to move into totally independent living.
Thank you.
So mine is in relation to the amount of capital. 2.2 doesn't sound a lot given the numbers that this is supposed to cover. So I suppose my next question is, what is this for, and then how much next will be the next capital ask?
Yeah, so the 2.2 is for this disabled home, the crisis same-day home, and a proportion towards the young person supported accommodation. with supported accommodation, we are wanting to work with a provider who can leverage in additional funding. So I think that's, you know, where we see it bringing in additional money. Often they can bring in money through housing benefit or through working with Homes England. So this is just for those 3 schemes, but in working with a provider on that supported accommodation, they'll be able to leverage in additional funding. And then for phase 2, we're still working up exact costings on some of the homes and elements that we want to do, in particular around the Care Leaver Hub, which is referenced for phase 2. So that's why we've not brought it together. We want to make sure that we've got an accurate picture of the finances for that before we come.
So do the buildings, do they physically exist at the moment? Is this about building new places, or is it about going out and finding somewhere on the market and then converting it, or a bit of both? Or?
A bit of both, but we are looking at the moment about existing provision, and so looking at either homes within the disposals list for Bristol City Council, so buildings that we already own, where we know that they might just need a bit of work to bring them up to scale. We are looking at the open market as well, and there'll be an assessment of homes that are identified around what's the most cost-effective option.
Okay, any other comments or questions? No? Right, so I need a seconder on this and things like that. So, right, so we've got 2 areas that we need to basically agree on. So one is to approve the full business case for the development of the homes in Bristol with a total cost at the moment of 2.2 million capital. And then authorise the Executive Director of Children and Education in conjunction with the Chair to take all the necessary steps to implement the business case, including to procure and award all necessary contracts in line with the maximum envelope that's outlined in the report. So I need to ask for a seconder for that. Is there somebody that's willing to back that? Thank you, Katja. And we need to take a vote on this. So if I'm going to ask people to raise their hands if they vote for both of these recommendations to take this forward. Unanimous. Thank you. And that takes us on then to agenda item number 13, which is the Childcare Development and Sustainability Services. And this is a recommissioning. And I think that we had there was a bit at the beginning of the meeting that looked at this. So Gail Rogers is not here. So Hannah, are you doing it in Gail's absence? Is that right? Yep. Okay, thank you.
Yeah, thank you. So this paper is seeking approval to vary our existing childcare development and sustainability service contract to extend it by 1 year until the 31st of December 2025 at a cost of £305,000. And that's to provide the childcare market with continuity in the run-up to the national rollout of increased funded hours. So the Childcare Act 2006 sets out a duty for local authorities to secure sufficient childcare for working parents. And to support the Council in meeting this duty, we commission the Childcare Development and Sustainability Service, which is currently provided by Bristol Association for Neighbourhood Daycare, BAND. And that, at the moment, that contract runs to the 31st of December 2024. One of the service's key objectives are increasing childcare quality, promoting sustainability and developing new childcare in the city. In addition to that, the provider is monitored against the amount of grant funding that they can secure for the sector as a whole. So in order to support the expansion of the funded childcare hours, the provider will be expected to support the sector, in particular with its sufficiency for under twos. As of the childcare sufficiency assessment last released in April 2023 showed that additional capacity was needed for under twos, so that's a real focus of their work. And to support all the children who will become eligible for 30 hours funded childcare by September 2025. And that sufficiency assessment that kind of identified that informed investment of £650,000 capital grant funding over the summer of 2024 into the childcare market in Bristol. So with the current contract end date of December 2024, that's right in the middle of the rollout of the expansion, and that could potentially destabilise efforts to support the sector to increase capacity. We didn't foresee this when the contract was originally let because the expansion of funded childcare places was announced in the 2023 budget, meaning it wasn't possible to set a contract length at the time we initially commissioned it to take that into consideration. And we feel that any change to provider at this stage of the rollout would mean that new provider had to develop substantial networks with existing childcare providers to be able to offer the support needed for the rollout, whereas the existing provider already has those networks in place. The variation to extend the contract is allowed under the procurement regulations, and during that extension period we'll undertake a full service review to determine the best way forward for recommissioning for 2026. And proposals to consult can include the division of services to those supporting equal access to childcare and other elements such as business planning or training and moving to a trading model, which some local authorities do. So it just provides us with a year essentially to really review what the offer is, and as we discussed earlier, look at, do we want more of a focus on deprivation, on access for SEND parents, and so it builds in that time as well to really have a look at what we want going forward.
Thank you. Any comments or questions from committee members on this? Gotcha.
I've known Ben for quite a number of years actually, in my work as a play worker many years ago. I do happy to have this proposition going forward, and also to make sure that we have more accessible childcare for all children, specifically those with SEND. And also those with SEND that have their sort of hidden disabilities, because that often come across places that won't take children with certain hidden disabilities, especially on the spectrum, on the ASD spectrum. So I really welcome this, and I'm also hoping one of the things I have to say, which I know Band used to be really good at, was the principles of play work, where children have a lot of access to themselves. And we were talking about children that are disadvantaged as well, being able to access this, because a lot of these childcare facilities sometimes provide the experiences that the parents, usually because of financial difficulties, can't provide for. And as a school teacher, and especially one that teaches food technology and DT, I teach those subjects of DT as well, the difference that a child that has had experiences teaching that compared to one that just doesn't have them, it's very difficult sometimes to get across some of the concepts and ideas if they just haven't done those kinds of things. One of them, for instance, I was teaching, I forget what the course is called now, restaurants and things, and some of them had never been to a restaurant, so how were they going to assess a restaurant if they've never been to one and they don't know what you're talking about? It's simple things like that. And yeah, we used to do that at the playground, take them out for experiences to the theatre, to the forest, whatever it was. And that would be really nice to see that band can do that, and that we can expand on that as well.
Yeah, thanks. And they're doing a lot of work around inclusivity, and we've also used them across our short break services as well to support those services to be more inclusive or to train them up. And absolutely, that is something we'll look at in the recommissioning process for 2026, just making sure that we've got in the service specification the things that we want them to be focusing on, that take all of those into consideration.
Kerry?
Just looking at the appendix F, consultation report, it says children should have access to green spaces. That's really lovely, but I think that depends on the area you live in. In Hartlepool and Willowwood, we've got lots of green space, but they're not always a nice place to spend time because there's a lot of antisocial behaviour. So we've got some really great community work trying to improve them. In our WhatsApp group, lots of the people in that group kind of say we don't even use the parks ourselves, even though we're trying to improve them. They will quite happily get a bus up to St Andrews Park or somewhere else in Bristol. So I think it's right, they should be able to access green spaces, but it's not always possible.
Yeah, and I think as a council as a whole, it's something we're trying to do in children's services, reach across into other departments such as parks, and that's been a big piece of work to try and work cross-departmentally around getting the best outcomes for children, and that's absolutely something we can raise as well.
Okay, so as there's no further comment or question, I'm going to take us through the bureaucracy. So this is a report again that's got 2 points. So the first point is that it authorises the Executive Director of Children and Education in consultation with the Chair to vary and award the Childcare Development and Sustainability Service contract in line with the procurement rules and the maximum budget outlined in the report. And secondly, authorises the Executive Director of Children to invoke any subsequent extensions or variations specifically defined in the contracts being awarded up to the budget outlined in the report. So in order for us to get through this, I'm going to ask for a seconder for those 2 areas.
I'll second that.
Thank you. And then by show of hands, those 4, this passing these points. Do you know? Okay. Thank you very much. And that takes us to agenda item number 14, which is the independent non-maintained special school block contract for places in Bristol. In Bristol. Okay. So there's right, okay. And again, this looks, you're subbing for Gail, aren't you, Hannah? Okay, thank you very much. So this is basically, this is it's an attempt to try and have a bit more kind of oversight and control, I suppose, over the non-maintained special school sector. Over to yourself, Hannah.
Thanks. Yeah, exactly that. So the paper is seeking approval to run a tender to block purchase 20 special school placements in an independent school in the Bristol area for up to 3 years at a maximum cost of 2.76 million. So the tender will be run under the existing INMSS framework that the council is a part of, and these placements will be for children who present with a range of complex digital learning needs. So currently we've got 261 children and young people educated in an independent or non-maintained school, and of these 38 are educated in a setting that's within the Bristol City Council boundary. The council is a member of the South West and Central Independent and Non-Maintained Special Schools framework, and will use the block contracting clauses within that agreement to run a competitive tender that's compliant with the public contract regulations. So we'll set a maximum annual placement cost of £45,000. That figure has been benchmarked against similar placements and offers us good value for money whilst being financially feasible for a provider. As per the terms and conditions of the framework, the provider would be eligible to apply for an annual fee uplift. Fee uplifts are capped at a basket of goods approach, so 40% of the teacher pay award, 40% of the NJC pay award, and 20% inflation with an overall maximum of 2.5%. So on that basis, the 3-year contract cost would be 2.76 million. So it's really about ensuring that where we do need independent places, that we're getting the best value for money through our contracting mechanisms. We know that some children will need independent places, and block contracting offers us better value for money as we're able to negotiate a reduced price through economies of scales. We're confident that we will need and be able to fill these placements, but we do reserve the right to transfer any unfilled places to other local authorities so that we're not at risk of paying for unused places, essentially. To join the framework that we'll be running the tender from, providers need to be registered good or outstanding with Ofsted and have passed quality checks. And then once awarded the contract, there'll be quality monitoring undertaken on the school to make sure that it is high quality provision and that we're happy with the education being delivered to our young people. So I think essentially it's kind of a contracting mechanism where we know we're making those placements just to make sure we are getting the best value that we can from them.
Okay, thank you. Has anybody got any comments or questions relating to this? This does follow on from the framework that we agreed previously. Okay, and these are these are for non-maintained that have a Bristol postcode, is that correct?
Yeah, exactly that. It will be a school within the Bristol boundaries.
Right, okay, and are we currently using those places? I don't want to say is it such and such a school, but is this something that we're currently using, or is it, and we're kind of trying to make it better for us, but also more secure, I suppose, for those schools, because they know that they've got X number of places that are used year on year.
Yeah, exactly that. It's around making sure where we've got those placements that we're getting the best price for them.
Okay, so this is a key decision because it is over £500,000, and there's 2 points, so I need to read them out. So the first one is that we as a committee authorise the Executive Director of Children in consultation with the Chair to procure and award the independent non-maintained block contract in line with the procurement rules and the maximum budget outlined in the report. And that number 2, it authorises the Executive Director of Children to invoke any subsequent extensions and variations specifically defined in the contracts being awarded up to the budget outlined in the report. So I need a seconder for that, please.
I'll second that.
Thank you very much, Katya. And again, this is so either for, against or abstain. So all in favour, hands up please. Unanimous? No, none against. Okay. And that's our last piece, isn't it? Yeah, okay, thank you very much. So, thank you very much. We're about 20 minutes, that's about right, because we didn't have any public forum, which is, I was a bit bewildered as to why we didn't have any public forum. Hopefully we'll get some next time. Maybe it's about what's on the agenda, I'm not sure. But thank you very much for everybody's attendance and your attention, and please do promote the foster carer recruitment and spread the video. And I'm going to jump on Alex in a minute and go, oi, write a report on this. Okay, thank you very much. Bye, good night.